Hello and welcome to this Lancet Moment. Today we are going to be discussing antimicrobial resistance, and with me in studio we have Dr. Prinsloo, a leading expert on the subject. Dr. Ben, thank you so much for joining us.
Thank you.
What would you think are the rules around using antibiotics that patients need to be aware of?
I think it's very important that you use the antibiotics as prescribed. If a doctor tells you or the healthcare worker tells you, you must take the antibiotics 3 times a day, you must take it 3 times a day, because antibiotics work in very specific ways and they need a certain concentration to be effective. So if you only take it once a day or twice a day, you might not reach that adequate concentration and it might not kill the organisms. Then also, let's say you stop taking the antibiotics and you have a couple of tablets left. You should never sort of just start using them again when you start feeling unwell again, or maybe even share it with a neighbor. You should never do that. You should go to your healthcare worker, you should be examined, and they should then see, is it appropriate to receive antibiotics again.
Do antibiotics expire?
They do actually. So, but luckily the expiration dates are quite, they've got a good shelf life, but it's also important if you do receive antibiotics to have a look and see, is this still within the expiry date? But that's not a big issue.
We know that antibiotics are being used for a whole range of different illnesses. What's the difference between using it for viral versus bacterial infections?
Antibiotics can only be used when the infection is caused by a bacteria. Viral infections cannot be treated with antibiotics. And it's interesting to know that most of our upper respiratory tract infections, so that would be something like an earache or sore throat or sinusitis, are actually caused by viruses, and they will not respond to antibiotics. So whereas something like a pneumonia is more frequently caused by a bacteria, where you urgently then need antibiotics.
Doctor, thank you so much for joining us in studio today. If you'd like to get more information, you can visit www.lancet.co.za. Thank you for watching and take care.